Hi, this is Dr. Mel. I want to talk about opioids and pain. It's an extremely complicated topic, and I think it deserves some time of its own. Opioids are painkillers or narcotics, hydrocodone, oxycodone, morphine, methadone, Suboxone, and heroin, and fentanyl. So the reason I want to cover this topic is that at Las Vegas Recovery Center, we treat people who have co-occurring addiction or dependence on opiate drugs with people who also have chronic pain, unrelenting, lifelong pain that causes them consternation and frustration, that aggravates their fear and anxiety, and that makes their life miserable. A typical patient that I'll see at Las Vegas Recovery, I just met with yesterday, he had back pain, he had a back injury, he had a back surgery, he had ablations on his back, and he had injections, epidural injections, and none of it really helped. And he found his way to a pain doctor who started him off on hydrocodone 3 times a day. He took 1 a day, and he did that for a couple of years. And then he found that 1 a day wasn't really going to do it, and 2 a day was okay, but 3 a day really was what he needed. So that's 90 a month of 5 milligram tablets. And after a couple of months, that really wasn't working, and then he went to 10 milligrams 3 times a day, and 10 milligrams 4 times a day. And fast forward 8 years of this medication regimen, and he's now on Percocet, which is oxycodone, 10 milligrams, 8 or 9 of those a day, and he also takes methadone, 40 milligrams a day. His doctor stopped prescribing, so he's going to a friend, and he calculated that he'd actually spent $100,000 in the last year on buying these drugs from his friend. So, you know, the problem escalated: loss of control, physical dependence, tolerance, withdrawal, the whole 9 yards. He's entered treatment because he sort of realized the nature of the fact that he was overusing his drugs so terribly. His wife actually confronted him with the amount of money he was spending, and he was miserable. Most of the time, he was either getting the drugs, working on getting the drugs, taking them, getting a little bit of benefit, and then they would wear off and he would be in relative withdrawal, and the pain would increase, and then he'd have to take another drug. Fast forward again, 3 weeks in treatment after some detoxification, he's no longer taking opioids, and believe it or not, his pain off the opioids is less than on it. So what can we conclude about this? Well, chronic pain is a complex, multidimensional phenomenon that happens in the brain. If we go after it with physical treatments, which is the common way the medical system does, like surgery or injections or adjustments to the tissue, we end up with an ineffective result, because most of the experience of chronic pain is not in the tissue, it's in the brain. Signal goes from the back through the spinal column, but it lodges in the brain, and guess which part of the brain? The midbrain. We've talked about the midbrain, the limbic system, where the emotional and survival center is based. Pain is one of the survival functions. So we now have this chronic situation of anxiety and anger and misery that is exacerbated by starting the drug wearing off, taking more drugs, escalating dose without any end in sight. So the complex interchange of taking the drug for relief, not for fun, not to get high. This is about taking the drug for relief, gets you stuck on the drug. And when you're stuck on the drug and you have chronic pain, you really can't see a way out. Turns out the way out is getting off the drug. Opioids cause more pain. They're actually inflammatory to the brain. We found that now. So that means on the opioid, you're likely to have a higher level of pain. You're always going to be in some level of withdrawal if you're physically dependent. So discontinuing the drug, preferably with medical assistance, maybe in a detoxification unit, leaves you without the drug. And now, here you are with pain. And what do you do about the pain? Well, it's a complex answer to that question, because it's a complex problem. We look at pain in 4 areas. We look at the physical, so in our chronic pain recovery program, people get physical rehabilitation, physical therapy and acupuncture and massage. They're encouraged to exercise, so they really get moving. They do yoga, they do qigong. So it's really all about that mind-body connection that really is enhanced. The second thing we do is deal with their thoughts. So we have these faulty thoughts. My pain is killing me, doc. I hear that all the time. Well, it turns out it's not killing them, or they'd be dead. The fact that we say the words, the pain is killing me, it's called the narrative, leaves us in a very precarious situation. So we help reframe the narrative, and cognitive behavioral therapy is one of the techniques that we use. People's emotions are off the charts typically when they're in pain, and as they get out of pain, their emotions, the anxiety, the fear, the anger, the frustration, the low self-esteem are all unbalanced. So we help people find new balance. And if you have chronic pain, it would benefit you to look at both your thoughts and your feelings. And then the fourth area is finding some spiritual connection, getting out of yourself, that all-consuming, all about me, frustrated, fearful situation, and really moving beyond and finding a way to live in the world, whether it's through spiritual healing recovery, through a 12-step recovery program, whether it's through meditation of any variety of kinds. And it turns out mindfulness practices benefit people with chronic pain to decrease the pain levels about 20% with practice meditation. So there's a whole lot of ways that you can get better with this chronic condition. It takes a lot of work, right? It's not the same as just getting a script and putting it in your mouth. But getting a script and putting the pill in your mouth leaves you trapped in the cycle of continuing to take the medicine, having worse consequences, being out of control, physically dependent, in withdrawal, feeling bad about yourself. There's a way out of that, and the way out is to look towards discontinuing the medication under medical supervision and then finding a way to live with your pain, whatever's left after the opioids are gone. And again, most people have less pain off the opioids than on. And you get a life that's better than you could possibly imagine at this moment. Good luck with that, and thanks.